We're looking at the hands. First thing we do is, of course, put them into anatomical position. You'll see we have both a right and a left hand. Palms forward, thumbs out. This is my right, this is my left. So let's look a little bit more closely. The bones are organized into, let's do it this way, 3 groups. We have 8 small carpal bones here at the bottom. We have a group of metacarpals. These are the ones that are hidden in your palm. They can be mistaken for fingers, but these are your metacarpals. Then in the end, we have our phalanges. Single is phalanx, plural is phalanges. The phalanges are divided into a proximal, middle, or distal phalanx. The thumb is proximal and distal. There is no middle phalanx on the thumb. And when we count them, we count the thumb, pollicis, as 1. Then we count the index finger as 2, then 3, then 4, then 5. So if we were going to talk about a specific bone, for example, this would be my 4th middle phalanx, or my 2nd proximal phalanx, or 3rd distal phalanx. That's how we identify these specific bones. Next, let's go back and look at our carpal bones. We have the bones arranged in 2 rows, our proximal row, 1, 2, 3, 4, and our distal row, 1, 2, 3, 4. Let's start with the proximal row. This first bone that looks like scaffolding is called scaphoid. The next one that looks like a little moon is lunate. You look under here, this 3-sided bone is triquetrum. This bone on top, which is a small sesamoid bone, is pisiform. So we have scaphoid, lunate, triquetrum, and pisiform. In the second distal row, we have trapezium, trapezoid, capitate, and hamate. So trapezium and trapezoid, if you go from lateral to medial or in alphabetical order, that might help you remember them. Capitate, this very large bone here, capitate comes from the same root word as capital, meaning large, like capital city or capital crime. And this last one here with the little hook on it is called hamate, and the hook is called the hook of hamate. There are a couple of mnemonics for remembering the specific order. One of my favorites is some lovers try positions that they can't handle. That's a cute one. Now we're going to look at a few important insertion points. We're looking at the anterior aspect of the hand. On the anterior, if we go up to the middle phalanx, here I have middle phalanx 2, 3, 4, and 5. This is for the insertion of Flexor Digitorum profundus. Here, the distal phalanges 2, 3, 4, and 5 are for the insertion of Flexor Digitorum profundus. On the thumb, the first distal phalanx is going to be for the insertion of Flexor Pollicis longus. We're going to turn the hand over and look at the posterior aspect. On the posterior aspect, we're going to look at the base of the 2nd, 4th, and 5th metacarpals. The base of the 2nd metacarpal is for the insertion of extensor carpi radialis brevis. The 3rd is for the insertion of extensor carpi radialis longus. And the 5th is for the insertion of extensor carpi ulnaris. So right now we're looking at the anterior aspect of the hand. We're going to look at the 2nd, 3rd, 4th, and 5th middle phalanx. This is for the insertion of Flexor Digitorum superficialis. The 2nd, 3rd, 4th, and 5th distal phalanx are for the insertion of Flexor Digitorum profundus. Then over here on the thumb, the first distal phalanx is for the insertion of Flexor Pollicis longus.